See, Sandra Osborne Hill? She went, I'm sorry, Jerry Arbiter's went. I've got, okay, so I'm on, that's the support, the opposed. Susan O'Neill?
Read this. I'm Susan O'Neill. I work for an undisclosed school district because you know, that school district. But anyway, we have wonderful insurance. It's costing every teacher district about $7,000 a year. That's a lot of money. We did not get raises this year. And one of the reasons, besides everything else, is the fact that the money went to insurance. It's very expensive. I have an idea of how, people have asked some questions, how we could get employees to help out with the government bureaucracy to handle this big plan. Get the claims adjusters from the insurance companies that deny us the benefits, move them over so they can actually pay our bills. You see? It is a social obligation. It is not a scam just to get the corporate CEOs money. And it's become a scam. How can we, cherry pick? How can we deny benefits? It's just a game, and it shouldn't be a game. It is a social obligation. Well, neither is education then, and neither are roads, and neither are politicians, and nothing else is either. And anybody, another thought is people who don't prefer government-sponsored programs like Medicare, opt out. They can refuse Social Security, that's socialized. They can refuse Medicare, just forget it. And actually they say, one of the reasons you have those programs, and one of the benefits is the capital that the older people have then gets passed down to the next generation instead of liquidating everything. So that's kind of a benefit for the baby boomers, to have their folks have Medicare and Social Security. And also they say that people who have medical insurance live, and those who don't. They die. And I think we're losing a lot of good people that way. It's quite unfortunate. And the other thought is that, say, for example, 30% of the country doesn't have medical insurance, and I really, really like the people in Congress, but maybe the people in Congress, we should arbitrarily pick 30% of them.
Yes.
And they don't get it either.
L-E-Z-O, Kent, first name.
My name is Kent Lazo. I'm a Littleton resident. In May, my wife was diagnosed with diabetes. In June, during follow-up evaluation, they found a mass on her pancreas, which was operated on 2 weeks ago. She's now at home recovering, and the word is they got it all. There is no other place in the world that could have provided the quality and the timeliness of healthcare. Yes, we need some reform, but for God's sakes, let's leave the delivery of the medicals that we now receive alone. I ask three things of you in going back to Congress in September. Do the best you can to help slay the dragon, kill H.R. 32 completely. Aggressively pursue that tort reform that you mentioned. Let's bring those costs down. Let's make it more affordable for everybody. Let's also get E-Verify permanently in place so we screen all the illegal aliens off our system.
ARD. Scott? I'm sorry?
That was Medicare.
My name is Scott Leonard, and
People be quiet.
waiting for the traffic. Mr. Coffman, thanks a lot for this meeting. In my personal life, I really value choices of all kinds. And I like to get as many choices as I can. And when I have choices, I can make choices, it gives me a very strong sense of personal freedom and independence and liberty. And I feel I have a strong sense of control over my life and what's going on in it. And I'm very happy that in my general life there are lots of public-run, government-run choices or private choices. For example, if I want the latest great book that's out there, I can choose the government-run public library, or I can choose the for-profit bookstore, and there are lots of other examples like that. I can choose the government-run recreation center that I go to, or the for-profit recreation center that I could choose. And there's private school and public school and government-run highway system and toll roads and all these kinds of things. And I'm glad for those choices that I have. And so when it comes to health care, I want choices also. I want the public option because I have no problem with government-run services per se. I'm not on Medicare yet, but I'm really looking forward to when I can get on that program. And I want the public option. I would like Medicare for all, actually, but I like the public option because I don't want to get my health coverage from any company that is whose bottom line is to make a profit from the human illness and injury and suffering and misery. I find that abhorrent and repugnant, and I really want a choice so that I don't have to do that. And so, Mr. Coffman, my request is that you find a way to give people like me this choice. Don't take choices away from me. One size does not fit all. I want all the possible choices I get. I think a lot of people do want this choice of the public option. They may not take it, but it ought to be there for them to choose from. And I think you ought to find a way to give Medicare coverage for everybody.
Before you start, sir, let me explain the timer. What we have is the lights behind you. When the yellow light comes on, we're going to give you 3 minutes, like I said. The yellow light will say you have 30 seconds. When the red lights come on,